Gentlemen, Dr. James here speaking directly. Have you ever paused and asked yourself, in the last several months, could your body be sending you a warning that you ignored? Maybe your jeans are looser by a few inches without working extra hard, or you've been fighting a mild, persistent fever. Or you keep waking up soaked in sweat even though the thermostat says 68 degrees. It might feel unlikely, but the numbers say otherwise. Approximately 1.2 million people in the U.S. are living with HIV, and about 1 in 7 don't even know it yet. AIDS VU +1. Relax. You're in the right place. In the next few minutes, I'm going to show you the 60-6-3 rule mechanism so you can take control and avoid waiting till it's too late. If this hits home, do me a favor, subscribe, and type a 1 in the comments so I know you're on board for more actionable men's health content. Most of you have heard the term HIV, but I can tell you from clinic experience that many still don't truly know what it does. So give me 90 seconds to be precise. HIV is a virus that targets and weakens your CD4 T cells, the commanders of immunity. And when these cells fall far enough, the syndrome we call AIDS appears because your body can't coordinate defense. Think of your immune system like a trained defense force guarding borders and infrastructure. When HIV dismantles the command structure, even everyday microbes become opportunists, turning a minor cold or mouth ulcer into a high-stakes infection simply because the sentinels aren't signaling anymore. Here's where men in the United States often get blindsided. Early after infection, symptoms may be mild or vague. Then many people feel fine for years. So weight loss, low-grade fevers, night sweats, swollen neck nodes, or mouth sores are written off as stress, overtraining, or poor sleep. That false reassurance is common, and the data show why vigilance matters. In the latest national update, more than 80% of new diagnoses occurred among men, and roughly 2/3 of those were attributed to male-to-male sexual contact, with ages 25 to 44 forming the largest share. CDC. By sex at birth, the most recent federal estimates indicate about 81% of new HIV infections occur in people assigned male at birth and 19% in people assigned female at birth, reminding us that risk is not exclusive to any one group and that prevention must be specific and inclusive. HIV.gov. Now, why do so many men miss it early? Because HIV's first act is strategic silence. It builds reservoirs and chips away at coordination. So the organ that fails first isn't your lung or liver, it's the defense you can't see. If this 90-second definition felt clear and complete for you, drop an OK in the comments so I know the pace and level are right for you and your friends. If you want me to go deeper on any part, how CD4 counts track risk, what undetectable really means, or where testing windows can mislead, comment Bo Sung, and I'll build that into the next video with step-by-step visuals. Jack is a real patient. When he walked into my clinic, the damage was unfolding, and I saw the pattern instantly. Months of unexplained weight loss, low fevers that lingered, and night sweats soaking his sheets multiple times a week. He kept training hard at the gym while juggling late shifts, chalking up fatigue and sore throats to hustle culture, blaming swollen neck nodes on allergies, and assuming mouth ulcers and rashes were stress or too little sleep. Like many men, Jack waited for a dramatic, undeniable symptom before testing, but HIV rarely announces itself that way. It whispers with subtle cues while your immune system's coordination erodes, which is why early signs are the most dangerous to ignore. Here are the quiet red flags I want you to recognize right now. Persistent low-grade fevers, unexplained weight loss, deep fatigue, tender or enlarged neck nodes, recurrent sore throat, night sweats, patchy rashes, and mouth sores or ulcers that stubbornly refuse to heal. In American life, it's easy to mislabel those signals as flu, overtraining soreness, shift work exhaustion, or aftermath of a big weekend. The calendar stays full, and health gets negotiated down to tomorrow, then next month, then never. That is how years pass while the virus builds reservoirs and undermines immune command, making ordinary infections riskier and recovery slower. And by the time the picture looks obvious, the best early window for decisive testing and intervention has already closed. I want you to pause and ask yourself, honestly, whether you have been renaming these signs as stress or bad sleep. If that sounds familiar, I need your attention tonight, because listening now is far easier than rebuilding later. The body whispers long before it ever screams, and if anything I described lands for you, drop a single word or any number in the comments so I know you're here, paying attention, and ready to stop guessing and start acting. Don't stop here. Give me 60 seconds because I need to introduce two names: gonorrhea and chlamydia. Most men who reach my office are in trouble, and there's a reason for that pattern hiding in plain sight. Think of sexually transmitted infections as a biological alliance that softens the fortress before the main army arrives. Inflammation, tissue damage, and altered local chemistry create conditions that make HIV's job easier, faster, and stealthier than most people ever imagine. Syphilis is especially treacherous because it forms ulcers and inflammation, tearing open the mucosal barrier that keeps invaders out. Those microscopic breaches act like unlocked doors, allowing HIV to contact vulnerable tissue directly and bypass much of the body's front line. Gonorrhea and chlamydia are different, but their smoldering inflammation recruits and activates immune cells expressing CCR5 and CXCR4. The more of these cells present at the site, the more landing pads HIV finds, amplifying susceptibility and speeding local expansion. Now stack the factors. Inflammation thins tissue, microtears from friction, and a mistimed test inside the window period. Together, they build a high-speed on-ramp, the highway that moves HIV from exposure to establishment while you still feel mostly fine. This is how it unfolds in American life. A party, an unprotected hookup, rough, dry contact without lube, a barber's reused razor-nicking skin, or tattoos and piercings done without strict sterilization. Shared needles or equipment seal the risk profile further. Too often, men dismiss the aftermath as razor burn, a yeast rash, gym chafing, or allergies, while immune signaling is disrupted and susceptibility spikes. Treating and clearing STIs early reduces HIV risk. Routine panels with partner conversations make prevention practical, normal. If anything I've explained could help someone catch an infection earlier by a week, share this video with one friend or family member today. That single action can interrupt transmission chains and save months of health you cannot afford to lose. Listen closely to this section. During recent trainings with new interns, I watched anxiety spike because of misinformation. So here is the concise version we teach. No shame, just facts to help you separate fear from reality and make safer choices. Route 1 is blood exposure. U.S. transfusions are screened and safe, but sharing needles, reusing lancets, non-sterile tattoo or piercing tools, and nicks from contaminated razors can transmit HIV, because microscopic blood carries virus even when it isn't visible. Route 2 is sexual contact. HIV enters through mucosal tissue during unprotected intercourse, and risk rises with inflammation or sores. Correct condom use plus lubricant reduces friction, while promptly treating STIs lowers the number of target cells HIV uses. Equally important are the non-routes. HIV does not spread by hugging, handshakes, sitting nearby, sharing toilets, pools, or utensils. Saliva, sweat, and tears do not transmit HIV in everyday life unless they are visibly contaminated with blood. Myths deserve precise answers. Mosquitoes do not transmit HIV, coughing or sneezing does not transmit HIV, and casual kissing is safe. Deep kissing is low risk, but theoretically higher if both partners have actively bleeding gums or open oral lesions simultaneously. In American settings, anchor behavior in consent and boundaries. Normalize asking about recent testing, agree on protection before intimacy, and treat sexual health like dental checkups. Routine, respectful, mutual. Talking early lowers risk by aligning expectations and removing guesswork. If this section helped you feel lighter, comment peace of mind. Don't forget screening. Saying you care means scheduling it. Many men do well with an annual panel, sooner after potential exposure or a new partner, because results turn worry into decisions. Clarity is protection, and myths are the real risk. When you understand the two transmission routes and the many everyday situations that pose no danger, you can act wisely, protect partners, and live without unnecessary fear while practicing practical, evidence-based caution daily. When Jack returned for follow-up, he finally opened up. He wasn't avoiding tests because he didn't care. He was avoiding them because he feared the look on someone's face, judgment, and the possibility a result would change how others saw him. He also described the classic American grind. Be tough, be useful, keep moving. Real men fix things quietly. Don't make drama, and never admit vulnerability at work or in relationships. So the easiest plan is denial. I'm fine, it's just stress. I'll go next month. There's also clinic anxiety no one talks about enough. The waiting room that feels exposed, forms that ask personal questions, the blood draw that makes you lightheaded, and the spiral of what-ifs that start at midnight and end with closing the laptop without booking. Underneath all of that is a protective reflex. If you don't test, the problem stays theoretical. But that reflex is what lets small issues grow, because biology doesn't negotiate with pride, and viruses don't pause while you finish a busy season. Here's how we dismantle the barrier in practice. Reframe testing as wellness, not confession, like dental cleanings or an annual physical. Put STI panels on a schedule. Pair tests with other habits, and treat results as information that guides care, not verdicts. In my clinic, we script the words to make it easy. I care about both of us. Let's test together so we can relax. And for yourself, I'm updating my wellness labs this month. I'll add the standard STI panel, which turns an awkward topic into routine maintenance. Leaders go first, and health leadership starts with you. Book the appointment when you're calm. Take a friend if that helps, ask for privacy options, and remember that testing shortens uncertainty, preserves choices, and speeds treatment, which is how strong men protect the people they love. Take a breath and relax with me for a moment, because this is the distilled playbook many U.S. physicians use, built for real life, and I'm going to deliver it in about a minute. Promise delivered. Here is the 60-6-3 rule that turns panic into a plan you can follow today, even if you feel unsure about clinics, partners, or what to ask. 60 minutes. After a high-risk exposure, move toward PEP as soon as possible, always within 72 hours, with the ideal window inside 24 to 48 hours. Call urgent care, an emergency department, or your doctor and request PEP. 6 weeks. Schedule testing at 4 to 6 weeks using a 4th-generation antigen.antibody test. If timing or symptoms warrant, add an HIV RNA test and keep using protection while you wait for results. 3 months. Repeat testing at 3 months to confirm. If negative and no new exposure, you can exhale. If positive, starting AR2 promptly protects your health and sharply lowers transmission risk, aiming for undetectable. Bring a tight checklist. Exposure history with dates, current symptoms, medications and allergies, and consent questions. Ask for a full STI panel and ask directly about UU and an ART start if anything returns positive. Use logistics to reduce friction. Book online when possible. Choose convenient labs. Set phone reminders, and pair testing with routines like dental cleanings, because simple structure beats late-night worry and lost momentum. If you already knew this rule, comment "knew it" so I can move faster in future videos. If this is new, or you want a deeper walkthrough with visuals and timelines, comment "Learn More," and I'll build that chapter next. The right timeline turns panic into a plan. Information creates choices, choices create speed, and speed protects your health and the person you love. Starting exactly where you stand today. Wherever you are today, worried or newly diagnosed, keep this commitment. Make health the priority you refuse to negotiate, because consistent care is what turns fear into control, recovery, and long-term stability. Start treatment early with antiretroviral therapy. When you take meds daily and show up on schedule, viral load drops to undetectable, meaning the virus is controlled so tightly that sexual transmission does not occur. The principle we call UUU. Undetectable isn't permission to coast. It's a foundation. Layer in 7 pillars: regular sleep, nutrient-dense meals, movement most days, stress management, no smoking or vaping, limited alcohol, and clinician-guided supplementation, not guesses pulled from social media. Mental health is medical health. Therapy or counseling helps you process the diagnosis, reduce anxiety, and strengthen communication with partners and family, which lowers isolation and supports adherence, because courage is easier to sustain when your nervous system is calmer. Adherence is the quiet superpower. Use pill organizers, calendar reminders, pharmacy auto refills, and travel packs, and keep an emergency dose, so life's chaos never steals consistency while you rebuild strength and confidence week by week, lab by lab. Commit to routine labs with your provider: viral load, CD4 count, liver and kidney function, and ask about vaccines, dental care, and STI screening, because prevention and early treatment protect energy, mood, and relationships. Talk respectfully with partners about protection and boundaries. Undetectable means intimacy without HIV transmission, and condoms still protect against other STIs, helping you keep trust high while keeping inflammation low, which is how you preserve health and connection. When doubt returns at 2 a.m., remember this: undetectable isn't just a lab result. It is your life returning to you. One routine, one conversation, and one night's sleep at a time. Keep going. Your future self is already thanking you. Here's a story I want you to carry with you. Mark is 28, working 2 jobs, and he came to me after noticing his jeans were loose, his sheets were soaked from night sweats, and his stress felt different. Heavier, slower, and oddly persistent. He'd pushed through final-style shifts, blaming fatigue and a scratchy throat on long hours and extra workouts. Swollen neck nodes seemed like allergies, and mouth sores felt like just coffee and no sleep. Until he finally paused, scheduled testing, and wrote the dates of exposures on his phone. At Urgent Care, we mapped a timeline: baseline labs, a 4th-generation antigen antibody test, and an early RNA when symptoms lingered. Results flagged quickly enough to act, and that speed mattered because biology rewards decisiveness, while indecision lengthens the window where small problems become entrenched. He started ART within a week. By the end of week 8, his viral load had fallen to the undetectable range, and his CD4 count began climbing. Sleep improved first, then appetite, then gym sets. A reminder that numbers change before confidence does, but both are linked. Talking with his partner felt harder than the lab work, so we scripted the words: "I care about both of us. Let's test together so we can relax." And "I want clarity because I want you," which moved the conversation from fear to shared responsibility and calm. The biggest barrier wasn't medicine, it was mood. Men worry honesty will kill the vibe, or that asking about tests implies mistrust. We reframe it as mutual care, consent, and respect. Protection doesn't ruin chemistry. It earns trust, which is what desire actually depends on. For men who need the playbook, Here it is: routine panels, condoms with lubricant. Treat STIs promptly: sleep, nutrition, therapy when anxiety spikes, and a calendar reminder for follow-up labs. Mark saw real changes in 30 days. Not perfection, just momentum he could feel. When you go first, the room steadies. When you ask the clear question, everyone breathes easier. And when you choose action over guessing, you model the exact courage another man needs to see. Courage is contagious, and so is clarity. Thank you for staying with me today. Every person who walks this road beside me adds fuel to serve harder, speak clearer, and help more men take back their health without shame or delay. I am grateful for this work and for you. Here is a quick recap for tomorrow's decisions. HIV is the silent enemy that weakens coordination, not just organs, so early signs feel vague and are easy to dismiss until momentum builds. Those quiet signs include low fevers, unexpected weight loss, night sweats, mouth sores, rashes, swollen neck nodes, and fatigue that lingers beyond stress or poor sleep. STIs like gonorrhea, chlamydia, and syphilis raise risk by creating ulcers, inflammation, and more target cells. Your practical safeguard is the 60-6-3 rule. After high-risk exposure, move toward PEP within 72 hours, ideally inside 24 to 48. Test at 4 to 6 weeks with a fourth-generation test. Add RNA when appropriate and confirm again at 3 months. Start ART early if you test positive, aim for undetectable, and remember, UTA-U means no sexual transmission when the virus is controlled. Build longevity with sleep, nutrition, movement, stress skills, smoke-free living, clinician-guided supplements, and honest conversations that keep trust high. Testing is self-respect, not confession. Protect yourself and the person you love, and let information replace guessing. Book the panel, keep follow-ups, and make prevention predictable, part of ordinary life. If this video brought calm and clarity, please subscribe and share to nudge a friend toward timely testing. One subscription can carry this message to someone who needs it now, and that ripple is how lives shift for the better. I appreciate you. I will be here next week in our Men's Health and Sexual Wellness series, answering questions with clear steps you can use the same day you hear them.